Hello, everybody at home. How you guys doing? We'll talk about Chapter 6, Long-Term Care. Okay, so we're going to look at three types of long-term care services. We're going to look at three activities of daily living and three activities of instrumental activities of daily living. And we're going to at least look at three different historical events. And we're going to look at the payment structure for long-term care. So did you know many people often pay out of pocket for long-term care services? So this would come out of their retirements, their savings. Some life insurance policy will pay for long-term care, but not all of them do because it's a life insurance, not a long-term care policy. It's a little bit different. Medicaid is the largest source of long-term care financing, meaning the elderly are poor. The Department of Labor has developed long-term care support and services competency model to train the workers that are engaged in long-term care support services. Another, did you know, according to the 2012 estimates, approximately 70% of people aged 65 years and older will require long-term care services, placing a heavy burden on the U.S. system. So according to the Department of Health and Human Services, long-term care services include a broad range of health, personal care, supportive services that meet the needs of older people and other adults whose capacity for self-care is limited because either of a chronic illness, injury, physical, cognitive, or mental disability, or other health-related conditions. So there's not just elderly needing long-term care services. All right, poll. So which of these would be considered part of long-term care? So list that, answer that, sorry. All right, most long-term care is not medical care, but rather assistance with basic personal tasks of everyday life. So these tasks are sometimes called activities of daily living. This is also the realm of practice of our occupational therapist. And these include bathing, dressing, eating, and going to the bathroom. Long-term care services also provide assistance for what we call instrumental activities of daily living, and those would include housework, money management, taking medications, grocery or clothes shopping, pet care, and using the telephone. All right, let's look a little bit about the history. We're just going to run through this one pretty quickly. So in 1722, England enacted the Poor Law, which created institutions for the elderly. And in the 1700s, the American colonies developed nursing homes, institutions in urban areas, which followed the English model. This gradually led to the establishment of nursing homes throughout the United States. And then, according to the Kaiser Family Foundation, long-term care has evolved over the past 100 years to serve the needs of the elderly and, of course, then the needs of those who have physical and mental limitations that preclude them from fully engaging in their activities of daily living and their instrumental activities of daily living. All right, let's look through the legislation, starting in 1965 with the Social Security Act amendments, which established Medicare and Medicaid. Medicaid program provided assistance for long-term institutional care, which fostered the start of the nursing home industry. So again, Medicaid is the services to the poor. All right, first open-ended question before Medicaid, how were the elderly people taken care of? So what do you think? All right, in 1974, another Social Security amendment provided federal grants for the states to support social services programs that included adult daycare and health support for the elderly, obviously, and as part of long-term care. In 1975, Social Security amendments created Title 20, which provided assistance for home and community-based services. Then moving on to 1978, the amendments to the Comprehensive Older Americans Act required states to develop a nursing home ombudsman program and to develop community care alternatives to institutional care. So this is really important, keeping the elderly in their communities versus putting them in a nursing home or just, like locking them away, kind of. What is an ombudsman? It's an official usually appointed by the government who investigates complaints, which are usually lodged by private citizens, against businesses, financial institutions, or government departments or other public entities, and attempts to resolve the conflicts or concerns raised. In 1990, the Americans with Disabilities Act required state Medicaid programs to cover Medicare premiums for lower income individuals, which would include a lot of the elderly. And then the act also emphasized the importance of integrating the individuals with disabilities into community and work environments. In 2000, the American Act Caregiver Program established state grants to fund family and informal caregivers who provide home care. So because it can be a full-time thing to be able to care for an elderly, it allow, if it was even a family member, to get paid for it, or at least get some kind of income for the time that they are taking care of their elderly parent or family relative. In 2005, the Deficit Reduction Act provided federal funding to states to expand community-based long-term care. So again, trying to keep our elderly in the community. In 2010, the Affordable Care Act provided states with the opportunity under the Medicaid program to improve their long-term care infrastructure. So again, with the graying of America, more and more elderly, we needed to not only improve the nursing homes, but also open up more long-term care facilities. In 2013, the American Taxpayer Relief Act established a Commission on Long-Term Care. In 2014, the Centers for Medicare and Medicaid Services provided new standards that community-based services must meet to be considered home and community-based services. Okay, so if you have a minute, you need to watch this video. It's not very long, but it's a really cool model in the Netherlands. And so let's look at the different types of long-term care services. The home care can be provided by family, friends, volunteers, or professionals. Short-term skilled care is covered by Medicare. So again, short-term, not long-term. So if they need to have a couple weeks in a nursing home to gain their strength back up before they can go back home, that would be covered by Medicare. Hospice care is often given at home for terminally ill individuals. So hospice care can be given at the hospice house or at home. Those are two different options. Community services are support services that include things like adult daycare centers, meal programs such as Meals on Wheels, senior centers, and transportation, maybe to and from appointments and different things like that. Okay, so quick poll. So would you prefer hospice end-of-life care at home or at the hospice house? And you can answer that for yourself or for a loved one. And so there are 4 general categories of long-term care institutional services. So this is where now we're outside of the home, right? So we have independent living, congregate care facilities, assisted living facilities, and skilled nursing facilities. Independent living covers a broad range of settings for the individuals who typically do not need regular healthcare services. Their target market is 75 years or younger. So these are elderly people who are still like really active and stuff, but they may want to be, in like a congregation of other older people and stuff like that. So for example, there's independent living at St. Bernard's Village. So all the benefits of being in your own home without the worry of maintenance, daily chores, cooking unless you want to. You'll be free to visit friends, travel, be as active as you care to be, with all the peace of mind of knowing someone is close. Sorry about that. Just in case you need help. Enjoy independent living in one of our spacious 1 or 2 bedroom apartments, each with a full kitchen, living room, large bathroom, closets, and pantry. Select an apartment with a porch or balcony if you want your own access to outdoors, or use one of the numerous common areas which provide fresh air, sunshine, seating, and glorious views of the gardens. So some of the things that they include here, we get daily meals. They can do they have services such as light housekeeping, so dusting, vacuuming, and stuff like that. Maintenance of the apartment, so if anything needs to be fixed. Daily social, recreational, and religious activities. Transportations to medical appointments. Utilities paid, including cable TV. Individually controlled heat and air conditioning, fire safety, emergency, tornado safe zones, pet friendly, etc., etc. You can see all the different services here. Okay, so then congregate care facilities, the target population in these facilities is 55 years or older. There is no assistance with daily activity and a state license is not required. They fall somewhere between independent living and assisted living facilities. So these facilities provide assistance for instrumental activities of daily living. So then we have assisted living facilities. They provide 24-hour supervision and assistance with instrumental activities of daily living. Recreational activities are provided, and depending on state regulations, there may be some medical care assistance provided also. So for example, same St. Bernard's Village, but you can also select the assisted living one. So then they say we handle the cooking, we do the cleaning, the laundry, and we can remind you when it's time to take your medication. Again, they provide 3 meals a day, housekeeping, maintenance, social activities, all of that, a lot of the same ones. It's just a step up from the independent living. All right, so then you have lastly the skilled nursing facilities. They provide care to the residents who cannot live independently. These facilities typically have age restrictions, increased security, and offer a range of social activities. So this is what we think of as nursing homes. True nursing homes where there's hallways and rooms, and there's staff there 24/7 to help people, and they help with baths and feeding and all of that. All right, next poll. So what arrangements are or were in place for your grandparents or older family members? So again, this is just a poll, answer to your liking. And this is another video that you really should check out. So this is kind of like assisted living, independent living for patients with Alzheimer's, older patients. So with mental, problems where they could not be at home. And so it's really cool. You need to check it out. All right, so how do we pay for long-term care? How are the elderly paying for long-term care? So personal funds is number one, and then Medicare, Medicaid, and long-term care insurances are all ways to pay for long-term care services. Medicare does not cover most long-term care costs. Okay, so again, very important. Medicare does not cover most of these. The individuals have to pay out of pocket for long-term care services until their personal funds are completely depleted. So it is very possible that a spouse or one of the grandparents goes through the entirety of all the savings and all the retirement funds and everything. Then once all of that is depleted, then they're poor, they have nothing left, so then they can access Medicaid to pay for them. Most continuing care retirement communities and assisted living facilities are paid for by the individual, although Medicaid may pay for the cost in some states. Again, so it's on the part of the person. The Veterans Administration may help with paying for long-term care services costs incurred by disabled veterans. Okay, so this is an interactive video. So this one you must watch, and you must answer the questions that are seen about the blue dots and stuff. But I highly encourage you to listen to the entire video. It is about paying for long-term care services. All right, Medicare covers medically necessary short-term care or acute care such as doctor's visits, prescription drugs, and hospital stay. That's what Medicare covers. And physical therapy is also covered by Medicare for conditions that will be improved. But again, Medicare does not cover this paying for an assisted living facility, staying at an assisted living or an independent living facility. So Medicare does not pay for the largest part of long-term care services, such as help with activities of daily living and those instrumental activities of daily living. It will pay for a short-term stay in a skilled nursing facility or home health care if certain conditions are met. And again, only for short terms, just a few weeks. All right, the Older Americans Act of 1965 has federal programs that provide home and community-based services to older adults. These programs are provided by state and local agencies and include in-home personal care, meals in the community and homebound, local transportation, respite care such as adult day care, and services for older Native Americans. These programs are targeted to low-income, frail or disabled, over 60, minority older adults, and older adults living in rural areas. And then an annuity is a series of payment over a specified period of time. Entering a contract with an insurance company for an annuity can help pay for long-term care services. So usually it's where you've paid in to it, to that insurance company for a while, and then so many years, and then you can touch a certain annuity out of that money, which means that they pay you so much per month or per year out of it as benefits, and then you can use that money to pay for long-term care services. An immediate long-term care annuity consists of a specified monthly income in return for a single premium payment. Deferred long-term annuities consist of a specified monthly income for a specified time period. These annuities are available to individuals up to the age of 85. All right, so life insurance policies are purchased to financially protect a beneficiary in the event of the death of the insured. So if you buy life insurance, you don't buy it for yourself, or I mean you're covered, but you buy it because you have a loved one that needs to be taken care of. That's generally a spouse, not spouse. They typically provide a lump sum to the beneficiary. So if you have a $100,000 policy, a life insurance policy, and you die, your spouse would get $100,000, and probably minus some taxes and stuff. Some life insurance policies with an accelerated death benefit can provide cash advances while the policyholder is still alive. But of course, let's say you have a $100,000 policy and you get a $20,000 cash advance, then upon your death, your beneficiary would only get $80,000, right? So again, the amount taken from the life insurance policy would be subtracted from the amount due to the beneficiaries. Accelerated death benefits are available if the policy holder lives permanently in a nursing home, is terminally ill, needs long-term care for an extended period of time, or has a life-threatening diagnosis such as AIDS. Selling an insurance policy back to the insurance company for its current value is an option to raise cash. This is known as a life settlement and is available to people that are 70 and older. The proceeds are taxable and can be used for any purposes, including long-term care services. Okay, so let's look at current trends in long-term care. So we have continuing care retirement communities that combine independent living, assisted living, and nursing care on one campus. So the example that I give you of St. Bernard Village is a continuing care retirement community. This aging in place model offers the opportunity to reside in a single family home, and as residents age, they can transfer to an assisted living facility and eventually to a skilled nursing facility. And so at St. Bernard's Village, there were actually single family apartments. But the senior must move into a CCRC when they are healthy and can live independently. There are 4 different categories of life care contracts with the CCRC. So we have extensive contracts, include housing, residential services, amenities, and unlimited access to health care at a budgeted monthly rate. A modified contract includes housing, residential services, and amenities, but only limited healthcare access. And then a fee-for-service contract includes housing and residential services and amenities. So amenities can be like pool and recreational activities and stuff like that, right? But no healthcare services at all. And a rental agreement contract on a monthly or annual basis does not give the resident access to healthcare services. Just a place to live, I guess. In 2001, the Robert Wood Johnson Foundation funded a pilot project developed by Dr. Bill Thomas called the Greenhouse Project, which is really neat, and there are some in Arkansas. This unique type of nursing home focuses on creating a residence that not only provides services, but is also a home to the residents, not an institution where they receive care. So this is completely different from a nursing home model. So the greenhouse is a home that is managed by a team of workers who share in the care of the residents, including cooking and housekeeping. The daily staff members are certified nursing assistants. All mandated professional workers, such as physicians, nurses, social workers, and dietitians, form visiting clinical support teams, so they come by and see them, and they assess the residents and supervise their care. So the first greenhouse was constructed in Tupelo, Mississippi. There are now more than 100 homes in nearly 20 states. and another 130 homes were under development in 10 additional states. This is a very much a growing model. It's really excellent. So this is another interactive video. So I want you to watch it. It is about the greenhouse project and just answer the questions that are in there. Is excellent. So it's just think about it as I would say almost like a sorority house or fraternity house for the elderly, with care, for they do the cooking and the cleaning and all of that kind of stuff. Okay, in 2001, in Boston, Massachusetts, a group formed a nonprofit called Beacon Hill Village. They formed a network to provide services to older homeowners that allow them to remain in their homes longer and maintain their independence. This network typically acts as a liaison to connect homeowners to needed workers. So, for example, I imagine if you were an elderly person and you didn't have any family nearby, and you needed your yard mowed on a regular basis, and you just couldn't do the task yourself, that would be something that you would reach out to Beacon Hill Village in that town, and they could hook you up with somebody that could do affordable lawn service for you. The membership organization's annual dues are approximately $600. A network of contractors and volunteers offer services that would typically be offered in a retirement community, so they can help with all the things that would be needed in a retirement community, so providing meals, helping with shopping and clothing and different things like that. There are now nearly 200 different villages nationwide of these and more in development. As the population lives longer, more people will need long-term care services. However, the majority of Americans are not planning for long-term care. The majority of Americans aren't planning for retirement either. They're hoping that the government will take care of them. So this is not a good plan, by the way. Government programs account for 63% of long-term care funding, with Medicaid providing 40% of that amount and Medicare 23%. So this is a big chunk here. Nationally, the median annual cost for a private room in a nursing home is more than $90,000 a year, and your average stay in a nursing home is probably about 3 years for long-term care, and probably more than that. So, do you have $300,000 that you could use to pay for long-term care? The federal government has been examining different alternatives to purchase long-term care insurance options. Consumers who have been concerned about the cost of their premiums going to waste if they do not need long-term care can purchase a premium return rider on a policy, although it is expensive. A more grassroots opportunity for the elderly are community networks that the elderly can join so they can access long-term care support services via that community network. So long-term care insurance was developed to cover services such as assistance with activities of daily living, as well as care in an organizational setting. So they could stay at home and have home care service paid for through their long-term care insurance, or they could go into a nursing home. The cost of long-term care insurance can vary based on the type and amount of services selected, as well as the age at the time of purchase and healthcare status. So if you watch the video on purchasing long-term care insurance and all of that, the recommendation is that you wait until you're 60 to purchase it, but purchase it at 60 and start paying the premiums. Most long-term care insurance policies are comprehensive, which means that they will cover expenses from home health care, hospice, respite care, assisted living and nursing homes, Alzheimer's special care, and adult daycare services. So again, respite care is respite care is actually for the caregiver, not the elderly person. So respite care is if, let's say, you're taking care of one of your parents, and I mean, this is like taking up all of your time and you just need a break. You need a break, several times a week, once a week, something like that, when you can hire somebody who comes in for respite care. So they come in and take your place for X amount of hours, for a day or whatever, so that you can have a break. And so it's excellent service, but it is for the caregiver. So tips for purchasing long-term care insurance. The policyholder can select a daily benefit amount depending on the healthcare setting. The policyholder can select a lifetime amount the policy will provide, which can range from $100,000 to $300,000. So if you think of, the average nursing home stay costing $90,000 a year, you can get an idea of about how much you might need to purchase. The policyholder can select an inflation option, which adjusts the coverage amount as you age. Some policies may pay for family, friend, long-term care for the policyholder. So that means that, again, it varies by policy, but if you were to be caring for your elderly parent and they had such a policy, then you could get paid for the care that you give for your parents. The policy also may provide reimbursement for equipment or transportation. All right, so as of this writing, long-term care services vary based on state priorities. In general, healthcare experts recognize the need for creating innovative ways to deliver long-term care services. A component of this type of innovation is the long-term care navigator, so helping you select all of these services, go through the decision process. So this service can assist individuals and their families with researching the different types of long-term care services provided by the state, reviewing their financial support for long-term care services, researching the types of long-term care facilities in their local area, and assisting them with a transition to a long-term care provider. So there you go. That is it. So if you have any questions about long-term care, feel free to put them there. And I appreciate you guys. Have a good day.